Welcome, everybody, to another podcast. We are speaking today with Heather Taylor of Heather Taylor Counseling. Welcome, Heather. It's nice to have you on.
Thank you. It's nice to be here.
Why don't you tell everybody about what you do and the modalities you have to offer?
Okay, sounds good. I am here in downtown Snohomish, and I work out of the Snohomish Apothecary and Wellness Center, and I am a licensed mental health counselor. And I am just super excited to be opening up my practice and serving my community here in Snohomish. It's been a dream of mine to do this for a while, and so I'm really excited because there's just some really cool modalities out there right now that can help people, and it seems like we're kind of in a tough time as a country, as in the world, and a lot of people are being more aware of their mental health and how it's declining. And so I think counseling services are really in high demand right now. And so I do several different methods. I do the regular talk therapy that I think most people are used to, and it's effective. Just being able to have someone to share your feelings and your memories and different things that are going on that might stir up uncomfortable feelings. So that's always a good one. But I also do something called EMDR and lifespan integration therapies. And those are two trauma therapies. And they're very well researched. And so I do those here in Snohomish. And then several days a week, I also work in Edmonds at a partial inpatient clinic called the Center, a Place of Hope. And so I'm getting some really good experience and just excited to be able to offer these sorts of things in Snohomish as well.
So when you talk about the modalities that you offer, and you mentioned trauma, why don't you give the audience some idea as to what might be, as a trauma heading, what might be under that because of all the anxiety and everybody being afraid and the political climate. Let's talk about that so we can kind of unwind. Trauma is a big word.
Yeah, it is a big word, and it's defined differently by different people. So some people might think of trauma and think of what, war veterans experienced, with bombs going off, or, you might think of it as being attacked by, a perpetrator. But you can also classify trauma as abuse as a child. You can classify it as abuse as an adult. I think right now what we're going through, people are experiencing a lot of trauma because they're losing their jobs, because our economy is struggling. People might consider trauma because they are having to be quarantined and they're cut off from their social network. So it's kind of, it's a nebulous word right now, because I think a lot of it is defined by the intensity that people are feeling. And
Right.
So trauma, it looks different for everybody. So, that's why I think some of these modalities that I'm using are really helpful, not only for depression, anxiety, but also for, people who've experienced abuse, war, whatever it is, so yeah, it's big.
So let's just briefly, I don't want to go too deep in this, do you treat adults only?
No, both EMDR and lifespan integration are good for all ages. Talk therapy is good for all ages too. You can also do play therapy with children as well. So you kind of get them to talk in the mode of playing. So yeah, there's all sorts of different fun things you can do with kids. So they think they're having fun, but you still get them talking about their feelings, helping them identify feelings. So yeah.
That is awesome.
Yeah.
And the reason I ask is because there is, the impact on families being, with the COVID, they're stuck together. There's just been months and months and months. And now a lot of people are struggling with the school issue and then on top of everything else. So if you why I asked. So it's an offer out there for families.
Yeah, for sure.
Good.
I think all families probably at some point have suffered some kind of trauma. I mean, I know like seniors this last year, they didn't get prom, they didn't get commencement. Uh,
Right.
that's traumatic. They waited a long time to get those things and they didn't get those rites of passage. That's traumatic. Kids not being able to be with their friends, is really traumatic, especially for specific age groups, because developmentally they need their friends. And so this is setting them back. And I think just the piling on of all sorts of stressors that parents are feeling, that children are feeling, can erupt into a traumatic feeling as well.
Well, and as we know, or with especially with teenagers, there's not a language to get to the bottom of things. So you can help them through that.
Yeah.
Well, that's good. So that's out there.
Yeah.
Now tell me, in working with someone, how do you determine what modality to head into helping them with?
I usually start out with just taking a general history, hearing their story, building up a trust relationship. I really like people. I like hearing their stories. So there's an enjoyment in that for me. It's an honor for me to be able to sit with people, especially when they're sharing really personal, painful memories. And so that's where I feel really honored that people would do that. And so then once I kind of know what their history is like and I know what their personality is like and how much they can handle, then I kind of decide what modality to go with. So with the EMDR and the lifespan integration, there are certain protocols that you have to follow to make sure that people can tolerate bringing up certain memories. If they can't tolerate them and they fall apart in your office, you're not really a very good therapist. And so you want to prepare them, give them some grounding techniques, how they cope with uncomfortable feelings that might come up. Because when they walk out of your office, you don't want them falling apart in regular life too. You want them to leave your office in better shape than they walked in.
So when you say they operate, the modalities operate very differently. Do they ever overlap?
Oh, I found that both of them overlap a lot in the way they function with the brain. And that's been that is what has been interesting to me, is the neurobiology of so much of this. I have been never a science girl. Science and math, not my things. But I have really been impressed with how complex and amazing our brains are. And, for all the science and research that we have in the world, we know so little about the brain, and it's amazing what it can do. And so with both EMDR and lifespan integration, it puts the onus on the brain to heal itself. You just start getting the body and the mind to start helping it move along. And once the body and the mind are available and kind of surrendering to the brain goes, oh, I know what to do. And it starts organizing and, putting things in place and putting memories where they need to go. And then the body sensations, that is usually what brought people in, the anxiety, the panic, the heart racing, the sweating, the, not sleeping,
Right.
those things start to settle down.
So explain to the audience what makes each of these modalities different.
Okay, so with EMDR, one of the characteristics that is kind of synonymous with this is the bilateral stimulation of the brain. So when a person comes into an EMDR therapy session, and they start doing the reprocessing, because that's what it stands for, eye movement desensitization reprocessing, and that's kind of explaining the process that you go through. So the eye movement is kind of the key factor, and it is a way to stimulate both sides of the brain to help it activate the memories, and then also to reduce the reactivity and the emotions connected to that memory. And so if you ever see somebody say something about EMDR, they'll say, oh, is that the modality where you do this? And it's basically the counselor, the clinician, will guide the client in eye movement, rapid eye movement. And that's usually through moving their fingers back and forth. They can use a light bar, whatever way they can, so that they can get the client to move their eyes back and forth while they're thinking about the memory and feeling, kind of going back and experiencing it in their mind for a short period of time. And then that helps the process kind of move forward, and the brain starts bringing up other memories. And then you process that, and then it brings up another memory. And once you've gone through the whole process and had all the new memories that have popped up, been thought about and gone through a bilateral set, a person is considered processed. They've processed that memory, and what they'll recognize is that that memory that may have brought up a lot of emotion and frustration and sadness or anger, it's no longer triggering. It's just something that happened in their past. And it's like the brain has just said, oh, you want me to put that away now? Okay. And puts it away and closes the file cabinet on it.
So to put it in even more base terms for people to understand, it's not that they forget or the memory is wiped out. It's just taking the charge out of the body.
Perfect. Yep. You said it perfectly. And with this, the bilateral stimulation, it's not hypnosis either. So the person stays present in the office with their therapist, who hopefully they have a really good rapport with, so they feel safe. But then they also go back in time in their memory, and then they process it through, the thinking of it, and then the bilateral stimulation.
So then tell us about the lifespan integration.
Okay, so lifespan integration is similar, that it is neurological. And so what happens in a lifespan integration session is that beforehand, the therapist and the client will meet, and they will talk about constructing a timeline. And so what the client will do is come up with a timeline from birth all the way to the present time. So for me, I'm 52. When I did it, I had 52 memories, and I had to start when I was born. And even though I don't really have memories of, the first 3 or 4 years, I can keep those blank. And then the first memory that I can remember, I put in, for 4 years old. And then I have a memory for 5 years old. And it took a while to construct the timeline, which is why it's kind of nice to do it on kids, because, they have a limited amount of memories that they have.
Oh, right.
But when you have the timeline all constructed, you take it to your therapist, and she will give you memory clues. So you come up with one word to help you remember what that specific memory was. And so in a session, the therapist will go through your timeline and will name off the memory clues, and then you will bring it to mind, and then you'll nod so that your therapist knows you remembered it. And then she goes to the next, or he or she goes to the next one, and you go all through your timeline. And it's a repetitive thing. You do this over and over until the person doesn't feel any more charge, to use your word, in that memory. And usually you're targeting a certain memory too. So you're trying to figure out, what was it that was so upsetting? So if somebody has a specific memory that they know that they need to get over, I can remember, my mother died. And so you might go from that memory to the present until you can kind of get the charge out of the memory of being told that your mother had passed away, or, something like that.
So what if someone says, I just can't remember anything in this number of years? How do you help them in that?
There is a way that you can help the person construct a timeline within the session. And sometimes these memories, I think people look for really like meaningful, deep memories, and they can be simple memories like, 5 years old, learned to ride a bike. 6 years old, went to first grade. Right. I think several of mine were, went to prom, graduated college. They don't have to be uncomfortable or awful memories. It's just a construction of the timeline so that you can remember and kind of have a little touchstone for each year that you were born. And one of the ways that it got explained to me for lifespan integration was kind of like the rings of a tree. When you cut a tree at the trunk and you can see the stump, and you can see all the rings for each year. When somebody has a trauma or something happens on one of those earlier inside rings, the way that they conduct themselves as they continue to grow, a lot of times are affected by what happened in those inner rings. And so those outer rings kind of get dysfunctional as well, because they've never dealt with what happened in the inner ring. So with lifespan integration and going through the repetition of the timeline, it helps mitigate a lot of the emotions that go along with it, but it also helps integrate something that may have happened as a child, and now you're looking back at it as an adult, and you're able to see it through adult eyes and not have the childlike reasoning and emotions that you felt, because you are basically telling your child self, hey, you're okay now, you're safe, your abuser isn't here, you're not in that traumatic situation. And it helps the brain settle it and put it in the file cabinet and close the door.
So, having experience with a similar modality, is this also where you're integrating a split off part of self that just gets stuck in that age?
Exactly. Yeah. It's not like a split personality or anything. It's just,
No.
yeah, a part of you. Like, we all have child parts, and, we have adult parts of us. People will say, well, like, a part of me wants to forget about this. Well, there's always a part of you that might not want to forget about it, because, if you were abused, you don't want to forget about it because you don't want to let your abuser off the hook. Or you don't want to forget about the sadness you felt when somebody passed away, because you don't want to forget about the person. But what it does is it helps integrate the parts, and it helps you see it from a clear and present perspective, and shows a child part that they're safe now, and that they aren't in the presence of an abuser or in a volatile situation.
Right. So that, to me, that speaks of, I'll use this as an example. Say you're with a friend and having a conversation, and they either shut down or they get this rigid or a body sensation, and you can see that. And then they become very, what could be said, well, you're being very immature. And that is that part of self that needs the help, correct?
Yes. And sometimes they don't even know that they are behaving that way, because they can be subconsciously triggered, because sometimes, the trauma gets stored in the body, but not in the explicit memory. And so the body remembers. There's a book, actually I have it. It's The Body Keeps the Score by Bessel van der Kolk. And I love this book because it explains to you how the body stores memories. And so we can get triggered by something, and somebody, a therapist will say, well, what were you thinking at that time? And they're like, I don't know what I was thinking. All I knew is that I got really scared really fast, and I have no idea why. And it's because the body remembers. The brain is amazing. And so it's picking up on all the senses, and something triggered it because it was connected to a memory a long time ago, maybe before the child even was able to, remember it, because they didn't have any knowledge or, experience in which to store it. So, a child doesn't know that abuse is bad because they haven't figured that out yet. A lot of kids think they're bad because bad things are happening to them.
Right.
So,
this is excellent. This is good. Now, when you start the process for the lifespan integration kind of therapy, and you've got the timeline, things, would a person expect that there will be numerous things or just a couple of things? So how will they expect to
I think it depends on the person. It depends on, what they're processing. It depends on how they tolerate things. I've been in sessions with people, and they tolerate things just fine, and we cycle through their timeline pretty quickly, and they feel resolved. There's been other times where I've seen sessions with people, like with a car accident. They had a trauma with a car accident, and so rather than doing an entire timeline, we did just a timeline with the whole car accident. And I saw that person react really strongly because it had just been a recent car accident. But by the time, an hour session went by and they had gone through their timeline, probably 2 or 3 dozen times, which can get exhausting.
Right.
They
Yeah.
they had resolved a lot of the fear that they had of driving at that point. So it really kind of depends on the situation and what they're processing, I would say.
So correct me if I'm wrong. It sounds like someone can come in and do an entire lifetime of a timeline,
Mhm.
or come in with what they feel is a singular moment, and you can create a timeline out of that
Correct.
and just do that.
Correct. Yeah.
That's pretty fascinating, actually.
Yeah. It kind of depends too, because what you'll find is that people might react to like a um, car accident, and then in the process, they start remembering other times when they didn't feel safe. And that's why the car accident was so traumatic for them, because when they were 5 years old and they got in a car accident with their parents and they couldn't get out of their car seat, that was triggering. And so that made the recent car accident so traumatic and triggering. And so you have to kind of go back then and deal with that old incident so that the new incident can also be resolved. So sometimes you discover other things that need to be taken care of when new things crop up. But if that's the new thing that brought you into the office to get the healing, then you might as well take care of the other stuff too.
That is wild. That is awesome.
Our brains are amazing.
Well, and that is the truth. I think people underestimate what's in their head.
Right. Yeah.
So when someone has anxiety about coming in to see a counselor, how might you approach, like, tell the audience what might help them get over the hump of being anxious about talking about themselves?
Well, for one, it's confidential. I am bound by law not to say anything.
Right, right.
So I could get in big trouble if I blabbed anything. So their secrets are safe with me. But also, I think it depends on them being really careful who they choose. So I always say go and make a phone call, and talk to the person, talk to the therapist on the phone, and just see if you have a rapport on the phone. Then, if you have a rapport on the phone, give them one shot. Let them have an opportunity to sit down with you, and then see how you feel there. And if there's not good chemistry, then just say thank you for your time, pay your fee, and be gone and find somebody else. But I always tell people, don't give up. If you find that you don't get along with a therapist, it's okay. Because I think most of us recognize that you're not going to get along with everybody. You're not going to trust anybody. I mean, I feel like I'm pretty trustworthy and I like almost everybody. But if I look like somebody's mom who abused them when they were like 5, 6, or 7, and I'm triggering them just because of how I look or maybe the tone of my voice, I want to refer them to someone that they can feel really comfortable with. So I always tell people, just keep looking until you find the counselor that you feel comfortable and feel like you can relax and then start sharing with, because trust is really what it's all about. You have to trust the person you're speaking to.
Feeling safe.
Yep.
Wow. That makes a lot of sense. People assume, and this is very generalized, but people assume if they go to a doctor or they go to a counselor, that's it. They should know how to take care of them.
Yeah.
And it isn't always the case, is it?
Right. No. I mean, it really is. sometimes it's a trial and error. Let's try this modality and see if it works with you. And if it doesn't, hey, I'll stick with you until we find something that works. But I feel like the modalities that I have chosen, I have real confidence in, and there's research to back them up. But again, if I get to a point where I'm working with somebody and we're not making progress, I will actually be the one to open up the conversation and say, hey, I don't feel like I'm able to help you much longer. How about we try and find somebody who's more qualified for what you're dealing with? Because really, when it boils down to it, I do this because I really care about people, and there's just too many people in our world hurting. And if I can have even a modicum of, I can help somebody even on a small level, then I'm excited to do that. That's kind of why I got into this, because it's just fun to see people smile and be able to live their best life. And so if I can help people do that, then that's a huge payoff for me.
Well, your passion around it all shows.
Oh, good. Yeah, I might need to take it down a little in session.
Well, I don't know. Everybody needs a little lifting up, right?
Yeah.
Especially
I like
right
being a
now.
cheerleader for people. I do.
Yeah.
I love encouraging, and I feel like I have this innate sense of being able to see people's potential. And when people can't see their own potential, I really I want to dig it out of them. I want them to see it. I want them to look in the mirror and see what I see. So
Right.
that's kind of how I view my job, is just let's start mining for potential in people.
That's excellent. Well, I think we've covered quite a bit. Is there anything you want to add?
Well, no, just come down and see us at the apothecary in Snohomish. And if you don't have chemistry with me, I have two gals that I work with, and they share an office next door to me, and they're fantastic. And so there's plenty of counselors down here, and we're taking people all the time. So I know there's a need out there. So just letting people know that we're here for them if they want to use it, and also just to kind of empower people to advocate for themselves for mental health. I know there's been a stigma about looking for mental health counselors,
Yeah.
and I just want to say I think everybody needs a mental health counselor, even and especially mental health counselors. So I have my own. I don't take insurance, however, so that might be a little hang up for people. So just to let people know, we're all private pay right now here. And so, you can look at our websites, and if you go on the Snohomish Apothecary and Wellness Center website, all of us are listed there. And then I'm again at heathertaylorcounseling.com.
Perfect. I thank you so much. It
Thank
has
you.
been delightful and very enlightening. I wish you well.
Thank you
It
so
has
much.
been a wonderful talk. Hey everybody, if you have enjoyed this video and you've seen some of the others, please give it a like and be sure to subscribe to the channel for future interviews that are coming up, and learn more about the local practitioners you live around and with here in Snohomish. Thanks.